Hello, and welcome to our podcast on mountaineering and trekking in the pandemic era. COVID-19 risk mitigation. This is Samir and I have with me, Mr. and India Muji. He is a renowned mountaineer and a writer who has been trekking in the Indian Himalaya for over 2 decades. Let's jump right into it. My first question to an India is we, as humans, have lived in caves and now in homes, formed tribes and alliances to help each other from known and unknown dangers like natural disasters, wild animals, diseases to name a few. And now that we are able to sustain that life, which is very well facilitated by a modern society, then why do we need to travel in such times? Hello everyone, and thanks for having me on this podcast. Customer here, I will start by quote one of my all-time favorite author Frank Smythe in his book, Concord Might says the pilgrim must brave the heat and disease of the lower Himalaya valleys. And finally the freezing air from the snow before he can accomplish his pilgrimage. Some fall by the way, side, and many more perish of cholera, typhoid, malaria, and other tropical diseases. Yet the greater the tribulation and the emulation, the greater the virtue and the forgiveness. Now, 2 things you can understand from that. Number 1, there are many reasons why you want travel. A pilgrim travels for his faith, while for his quest. In the process of climbing mountains, we seek that something unknown, something magical, and something far greater than ourselves. Going to the hills, looking up to the mountains, always had its aesthetic value above athletic, and given the value of mountain sports to the general physical and mental health of large numbers of people. Following certain principles may allow a less restrictive approach to mountain sports as we face farther waves of the virus in future. Anyway, number 2, disease and travel have been linked since the dawn of time. Even prior to COVID, you had to get vaccinated with yellow fever, etc., before traveling to places like the Amazon or some of the countries in Africa. So getting vaccinated before traveling is certainly not something new or unattainable in this context. I would also like to mention here that a very recent research has found out that the risk of contracting or transmitting SARS-CoV-2 appears to be very low while participating in outdoor mounted sports. Now, given our ever-increasing knowledge and understanding of the virus and its modes of transmission, we can identify high and low-risk situations and apply simple procedures to minimize the risk, even when the virus is prevalent in the community. As a whole, given that we are already in the year 2 of this pandemic with no end in sight, I feel we have to start living with it and adapting our reality to it. Yes, these are scary times and it's completely justified to be paranoid, but don't let it get the best of you. Inculcate working out in your routine and keep your immunity boosted. Some might think that it is shelf with our thoughts turning to outdoor activities like climbing or hiking now, but we must remember life is returning to normal elsewhere. For example, in Cordera Blanca, Peru, my friend Za Rosa is able to guide people in Mount Kenya. A friend of mine, Chris Maki, is taking GRS for hiking in Scotland. My friend, Susan Jensen, is able to go track climbing in Ireland. Alanza with his friends are hiking and climbing. And lastly, my friend also RGO Per, a Polish climber and photographer, is currently on K2. Given the accumulated experience of COVID cases in outdoors from all over the world, it is now possible to make a rational risk assessment and provide mitigation guidance to make our sports safer. From the COVID-19 point of view, we must remember that this is not our first battle with the pandemic and definitely not the last. These too shall pass. Very well said in India. And I must add, it's very encouraging to hear about your friends who are now successfully able to carry out the mountain air trips. And, this brings me to the second point of our discussion, with the mountain states across the Indian Himalaya being open to tourism. There is now a rush amongst the romantics and the adventurous to plan and book their much-awaited holiday in the hills. They have been separated from their beloved for far too long. And now with the unlocks announced by the states, people's bags are packed and they're ready to go. Trackers and climbers are keen to utilize the months of July, August, and September as a little window of opportunity between the repi of the second and the projected third wave as a natural response to the happenings, with the sigh of relief. Tracking agencies have put up their back-to-business signposts across social media platforms, as everyone related to the industry are looking forward to some work. After the long pandemic pause, we have also seen the case of Hartford Josie, who has caught COVID at Everest Base Camp. And despite that, he was able to recover and scale Everest. So my second question to an India is, what is the situation like in high areas, and what risk should one consider before going for a trek? Before I begin with what must be kept in mind before traveling to the mountains, I advise you must do your research on the current COVID scenario in the particular location you are planning to visit. The situation is so dynamic that situational information shared today may be obsolete in less than a week. So keep yourself updated with the latest info about COVID protocols. If we look at the pre-monsoon season of Everest and other mountains in Nepal this year, we will understand why this pre-monsoon season has already seen the first cases of COVID-19 infection at Everest Base Camp, which was not only limited among the tourists, but infected the local crew as well. Coupled with the Everest COVID incidents and the Indian population's recent experience with the Delta variant, there is a vital learning, and we need to adopt that into our travel plans on an urgent basis. We know risk is the fundamental part of any adventure, but now the word risk as we once knew and understood is amplified by this fluid and ever-evolving virus. This is the time to remember that mountains not only sets our spirits free, but also teaches us to be disciplined and responsible in these pandemic times. We therefore have no right to increase these risks by pursuing a reckless and irresponsible course with certain impact on the local community. For example, only last week, Khor has seen 30% COVID positivity rate, which is alarmingly high, of course. And if you look at the latest street scenes of Shimla, Manali and Missouri, and pay attention to the announcement by the Han Chief Minister that he's going to start the chart soon, we should really prepare ourselves before venturing out to the hills. It is specifically in this current scenario, the responsibility now is both on the traveler and the commercial service providers. We need to remember that whether we are approaching the hills as an individual tracker or as part of an expedition team, we do have a duty of care to the employed staff and maintain a fine balance of providing income to the local staff against increasing risk of exposing them to the virus. Now, risk management in terms of tracking or mountaineering has been an established field with professional advice available from international bodies, like the UIA and our very own Indian Mountain Foundation. Both the organizations have issued advisors time to time during this COVID era. It'll be prudent to have a look at their websites and download, read, and follow the guidelines set by these bodies. Now, those planning to travel and track in July, August, and September, please abide by the travel advice provided by the state governments, the village councils, along with the UIA and IMS. Thanks in India for the insight. Links to the guidelines are mentioned in the description below. Be sure to read and implement them on your travels. This brings me to the last question: how to mitigate the risk, and what additional steps should we take in regards to COVID-19 and tracking in remote areas? In general, there should be mitigation strategies pre-planned and should be part of our thought process from now onwards. There should be a clear list of do's and don'ts. For example, number 1, pre-departure must-haves: 1. Vaccination and antibodies test. If you have been vaccinated, it does not mean that you have developed antibodies after your vaccination. Get your antibodies test to validate effectiveness of vaccine. If you have substantial antibodies, then you are good to travel. Number 2, RTP here negatively thought of no than 48 hours. This will be needed to enter a few states if you're vaccinated. Number 3, travel insurances with COVID cover and EPAs, depending on the states. Number 4, reusable, mass sanitizer, weight wipes, and fever medication. Number 5, A contact sheet contacts of all necessary local authorities value of your visit for emergency like police, the disaster management and medical context. Then comes what to do during the journey. Number 1, using private transport with limited occupancy, rather than the public transport. Number 2, use of a PPE kit on airplanes and open windows in public and your own even private road transport, and maintaining of social distancing as much as possible. And number 4, avoid eating and drinking in public places. Then comes the point of what to do at the destination. Number 1, during the trek, for example, you should camp outside of the villages, and one should not use the same water source as the villages do. Number 2, by always taking into account the views of the local population and local administration, where one's activity is planned. Number 3, maintaining social distancing with the local community and other standard COVID protocol while passing through towns markets, and while staying at a hotel or a village guest house. I would like to jump in here and mention a few points about the stay at the destination for hotels on your way in and out. Follow the following rules. Always wear a mask for safety. Wash your hands often. Avoid using the pool, gym and spa. Try and restrict entry of others into your room, including housekeeping. Prefer online reservations and contactless payments. Prefer outdoor dining over inside a restaurant. Use the stairs rather than the elevator. Park your car on your own. Ultimately, it is always better to weigh the risk of staying in a hotel against your chances of getting infected. Prefer camping. If choices are available, above all, choose a hotel that is following the COVID protocols. Back to you in India. You are absolutely right somewhere. Finally, I would also like to add a couple of more points to the risk mitigation strategies. Number 1, it is essential for everyone to self-isolate and to do a test. If they have symptoms, carrying a do-it-yourself kit, along with the pulse oximeter, should become a new addition to the packing list of the climb. The two together can help identify COVID in time, and one can take necessary actions as planned in their crisis management strategy. The test kits are readily available online at nominal prices. Be sure to carry a few on a trekking and climbing trip. It would not be a problem to isolate and quarantine a person with mild to moderate symptoms, of course, in a designated tent. Number 2, finally, there should be a clear crisis management strategy in place, especially if we are talking about trekking or mountaineering in a remote area, which is an emergency evacuation to the nearest hospital with proper medical facilities to handle COVID patients. Follow the ever cautions while traveling. Stay motivated. We are humans, and humans adapt, survive, and thrive. Excellent point. And on that note, we conclude a podcast. Thank you, and stay safe.